Hi, I'm Dr. A P Nirmal Raj. I've done my specialty in prosthodontics and I'm practicing at Premia Dental Care, which is at Nandi Durga Road. There are various options that are available for tooth replacement. So most of the times the patients prefer a fixed option rather than a removable option. So what are the various fixed options that we have? One is called as a fixed partial denture, wherein you have the empty space or the edentulous space, it's called. You reduce the teeth both mesially, that is in front of the edentulous space, as well as the back tooth of the edentulous space. The immediate back tooth and the immediate front teeth, which is surrounding the edentulous space, you reduce them, you make it a little smaller in size, and you give it as a 3-unit bridge. That is called as a 3-unit crown and bridge, where we reduce both the anterior teeth as well as the posterior. This is called as a fixed partial denture, which is being followed for ages now, and it's been one of the most successful form of treatment, and it is continued to be practiced. And there are various materials that are being used for replacing in that. It started off with metal, then we had metal ceramic, we have now crowns like zirconia. So there are various advancements that have occurred in the replacement of missing teeth. Some patients do not want their adjacent teeth to be touched. Then what are the other options that we have? The only other option that we have is an implant. An implant is nothing but a biomaterial which is made of titanium that is placed within the bone, and we allow the implant to heal within the bone. Once the implant heals within the bone, it takes a few months for it. That is called as osteointegration. Once you get a good bone implant interface, then we can go ahead and give a denture on top of it or a crown on top of it or whatever form of treatment. So these are the fixed options that we have for replacement of teeth. We also have what is known as the removable options, where we have the removable partial dentures. Let us say you do not have a posterior teeth. You have an edentulous area, mesial to it, or in the front you have a teeth and behind you do not have any teeth. Then you should not go for giving a cantilever bridge. What we need to give is a removable option or a removable partial denture. So a removable partial denture must be removed by the patient every day and placed in the water, and then next day the patient has to wear it. But many patients do not prefer this option, but when we are limited options are there and when we cannot place implants in certain patients, then removable partial denture would be the best line of treatment for such cases. We have various options in removable partial dentures also. You have cast partial dentures and you have flexible partial dentures in which patients can feel comfortable, which can be used as a treatment option. You also have what is known as a fixed removable option, which most of the prosthodontists do practice, which is known as precision attachments or semi-precision attachments, which can be used in patients who do not have their posterior teeth, only have the mesial teeth or the front teeth for taking support. Then we can use what is known as a precision attachment. Thank you.